Hold on to that. Each day, in every way, let your heart find contentment in saying, my living and their living shall not be in vain. And that is God's message around love thy neighbor. Thank you. Thank you.
Okay, awesome. Thank you so much again at the gifts. So up next, I think we're starting this with Gary up and not wasting any time. So up next, we have Senator Robin Kennedy. It is my second time in like less than. Okay, so I'm going to introduce another person who's also incredibly amazing. And I always like to give association to the direction that, and I'm hopefully getting better at this, but this is your district. It is your district. Yes. Thank you. Because I messed it up the last time. But so this is David's district. And interesting fact, I have known David for so many years. We are both alums from South High Community School. Of course, when we went there, it was a lot different than the newer building right now. And if you have not been there yet, I ask you to go there. But David is an incredible advocate here in our district, in our city of Worcester. He shows up, and those are the kind of politicians that we want to see. Not only shows up, but he shows up and he supports the African community. Whenever you call him, he's there. So without further ado, I would just love to introduce Rep. Digital Boss.
Thank you so much, Gemma, for the kind introduction. Again, thank you everyone for being here today. So my name is David LaBeouf. I'm the state representative for the 17th Worcester District, which is essentially the southwestern side of the city. So from here, Columbus Park, Mill Street, Washington Heights, all the way into the town of Leicester. And it's really important to be right here in the heart of the city, reaching out to our constituents that are really in a healthcare desert. We have a lot of great facilities here and a lot of great organizations, but the need is so great that even with that, we need to really reach people where they are. And that's the mission that I know every single individual here is doing, whether it's making sure that we're getting healthy education options with Head Start, or making sure that all of our children, regardless of circumstances, through DCF and our foster care system, and making sure that you're treating people for whether it's prostate cancer, diabetes, high blood pressure, or just anything that makes sure that someone's quality of life from infancy all the way to being seniors, like over here at Elder Services. So thank you so much for being here. I'm really looking forward to working with you. And of course, if there's anything that my office can do to support, Gemma and Lovo have my number, so you can, and Maxwell does too, so they can find me very easily. But I hope you have a great rest of the day, and thank you.
Thank you. Thank you. And I just want to say thank you so much to Representative David LaBeouf. And I know it's early in the morning. I don't want to say like all African people are the same, but I think Charity, when she did the flyer, probably people saw 8 in the morning and thought like they added their own African time here. And one of the things that we want to stop doing, right, in our community, for some of us who are in this work, supporting our community, supporting people in our community, we really want to get get away from that. And I'm also speaking to myself. Right? So, without further ado, I just want to say thank you. I want to say welcome. I see Uncle Maxwell. He's here, and just want to give him recognize him. So thank you for being here. And without further ado, I have a wonderful individual to announce. So. Senator Robin Kennedy, entrance. In fact, also in less than a month, I've had to introduce her several times at a ceremony. And Robin is an incredible person. I've worked with her at the YWCA, and her advocacy here in the community, supporting youth development, supporting health, even the new bill, the maternal and child bill at the state level. And so these are all things that our community needs. And community health, like Rep said, is so incredibly important. And so that's why for us to all be here, to have, you know, our nurses from our community and have volunteers from our community, I think the more we continue to do this, right, we're also encouraging people in our community to step up and come outside and be here. So I welcome Senator Robbie Kennedy.
Thank you so much, Gemma. It's such a pleasure to be with you. And I don't know, I'm kind of getting used to having that buffer of time. So I appreciate that. I appreciate it. But, you know, this right here is what I love best about Worcester. It's the community that we have here, and a community that shows up to take care of each other. You know, we saw that during the pandemic where, like many other places, we didn't turn on each other, turn to fight each other. We turned towards each other to care for each other, to lift each other up. And that's incredibly powerful. And we see that continue day in and day out, where we have organizations that sole mission is to connect with their community, to make sure that every member of our community has access to the health resources, to the care, to the preventative treatment that's going to lead to long-term care, long-term success and health. And that's so incredibly important. So I'm just really grateful to be able to be in community and to share community with all of you. And to Gemma's point, what's also so important about organizations like My Health Matters and all the organizations really that are here today is because it's also about shifting policy. The maternal health bill that Gemma that spoke to is about addressing the disparities for maternal outcomes, particularly for Black women, which we know are unfortunately 2-3 times higher than their white counterparts in maternal morbidity rates. And so understanding where those gaps in access to healthcare exist, understanding where there's better forms of access and care and treatment, such as things like access to doulas and midwives, which is a big part of this bill. Also about looking at shifting our healthcare systems. You know, we see, unfortunately, with these private hospitals, we see them closing left and right. Even some of our nonprofits, unfortunately, are closing some of their birthing units in other parts of their facilities. And when we look at better ways to provide care, we look at models like birthing centers. And another big part of this bill is about making sure that we have access to more birthing centers in our community, so that folks not only can have access to care, but have access to culturally responsive and reflective care, not just responsive, but reflective. And so I'm just really grateful. I know it's bright and early. I know folks are going to continue to come out because I know our community always responds when there's an opportunity to connect. And I can't think of a better way to start the morning. So thank you all for being here. Thank you for hosting this. Thank you for the work you do each day. Thank you.
Thank you too. Hi, John.
Okay, so we're just going to continue this. First and foremost, I just want to recognize all of the nonprofits that are here, just wonderful in the city of Worcester, and all of the nonprofits that not only supporting with their time, but like sponsoring and that kind of support services. So Elder Services of Worcester, Worcester Family Partnership. These are so much incredible organizations. See, I know each one of them individually, and we need to really utilize what they are bringing in our community. Massachusetts Department of Children, and then I have over Safe Exit. Yes, I saw you guys recently just opened up or had a.
Yeah, we just had a reopening of our drop-in center. So it's a low barrier center on Cambridge Street.
Wonderful, wonderful. Change, Community Health Awareness Network, Grows Equity, a nurse, oh my goodness, herself, Worcester Child Development.
Hi.
Incredible. And then of course Health Matters.
I'll come to your table later.
Oh, wow. Man.
Hey, doctor.
Go 2-3 rounds each, right? So, because Gold Coast is delicious, always, coming through for the community. So, we just want to say thank you for that. And then, of course, Theo on giving us our media support. So we say thank you, and thank you for everyone who are volunteering their time to be here today. So, I believe we'll kind of put a pause in the introductions. We asked you If you are a person here, you know 10 people, give them a text.
Hello, so this is Obaapapa Theo reporting live at the My Health Matters Foundation for this special program that they are doing today. I'm here with
David LaBeouf. So I'm a state representative for the 17th Worcester District, which is right here in the center of the city of Worcester.
and thank you so much for coming.
Oh no, I'm always happy to be here. It's great to see an organization like My Health Matters really reaching out to the community and helping out my constituents that really need to make sure that they're getting informed of their health and getting the services they need.
Okay. So how do you see this organization?
It's great because it's really highlighting, a particular health need, but also making sure that every single individual, regardless of their background, really, gets, their needs met. Lots of times in the healthcare system, especially for whether it's our immigrant communities or communities of color, and especially for women, sometimes, the needs aren't necessarily understood all the time by how the processes work. And so going directly to people and making sure that you're finding a way to talk about the health matters and addressing kind of what are the specific reasons behind it, it's just a wonderful situation to have. And it's really nice to have the organization right here.
Okay, so I know this is their first time doing it by themselves. So what are your expectations from them in the near future?
Sure. So, definitely, as, the organization continues to work with the community, we love to hear feedback. What did they find successful? What were things that they were hearing from people that they really need support on? And what are some things that we can partner on? I think that's the greatest thing, is because, especially in a role of government, we can help with some policies, looking at some different programs, but if we don't have those eyes and ears and basically hearts within the community helping us guide that, it's not going to be effective.
Right. Thank you so much for coming.
Thank you. I'm happy to be here. And again, I hope you have a great rest of the day.
You too.
All right.
Thank you.
you.
Hello, good morning. I'm here today with
Senator Robin Kennedy.
Hello, Senator. Thank you so much for coming. You're always coming to support, and we do appreciate that a lot. So, how do you see this special organization?
And thank you for inviting me to be here. I keep saying this is the greatest part of Worcester is our community and the way that community shows up to take care of each other. And I think that's what's so important about My Health Matters. It's about connecting with the community, helping to make sure that community members have access to healthcare, to resources, to education, to make sure that everybody in our community has the opportunity to be healthy, and that's incredibly important. So this outreach is amazing.
So how do you see it benefiting all the community in and around Worcester?
So it's about that intentional outreach. We know that there's huge gaps in access to services and access to healthcare and resources and disparities in that, oftentimes along racial or ethnic lines. And so making sure that there's culturally responsive organizations and culturally reflective organizations that can help connect with community members, helps community members feel a sense of safety and comfort in accessing healthcare, and that makes sure that everybody has access to the resources, and that's incredibly important.
Okay. So what some of the things you are expecting them to do different next time?
Well, I think, to me, it's so much about it is the preventative piece of it. It's about the community education. It's about making sure that folks are getting their blood pressure checked. Again, so often our healthcare is so costly because folks aren't getting preventative care, and so they're waiting till issues become more extreme, which is always not only more dangerous for the individual, but it also becomes more costly in the healthcare system. And so if organizations like My Health Matters can help connect individuals with some of those preventative services, again, like blood pressure checks, then that also helps individuals, again, catch issues before they escalate, and it also keep their own medical costs down, but it also is better for the overall healthcare system.
Thank you so much for coming
course.
out today to help this organization. We
Absolutely.
do appreciate it a lot.
Absolutely. I'm grateful to be able to be here this morning, so thank you so much.
You're very welcome. Thank you. Hello, so we have with us our sister Charity, who is the CEO of My Health Matters Foundation, who is doing this today to help the community. So Charity, how's it going today?
It's okay. It's a bit slow because it's a holiday weekend, and I guess it's Saturday as well, and people are just waking up late. So we started at 8, but people started showing up close to 10 o'clock. So apart from that, so far so good. Senator Kennedy and State Representative and Gemma Kamara. They were all here to support, and we have a couple of vendors here as well. We are here for the community, so I'm grateful to God that people understand our vision and they also want to buy into it and help us serve our community.
So what do you want to tell people at home? What do you want to tell them right now?
We have bring your children here. We have a dentist here who can give you education about healthy keeping dental life. We have nurses here. We have doctors here as well, and we have a lot of things going on. We have free food. We have free school supplies, backpacks, and books and everything. So if you are home and you can make it here to the Y, just come and be a blessing, and we can also be a blessing to you.
It's at the Y place. If you're home
On Main Street.
On Main Street, come over, come check your health, and then be part of this ongoing health screening. Thank you so much, Charity. You're doing a great job. And
Thank you.
God bless you. Thank you.
God bless you.
Hello. And I'm actually sister. Let me go to our coffee. I crack about our family. Sister Sylvia, I'm going to what to say. The radius say also about such a good cause. Yeah. We appreciate you about the community. Do appreciate you guys a lot. Okay, how do you see it going right now?
So far, so good. We do hand chair, but you say all the tables are being filled with people. Who try self. We check on blood pressure, blood sugar, and other things. And I think it's a little early, and I can already foresee people will be coming. It's going to be successful.
All right. Yes, Sister Akasa, Mama Nakasa. But I see baby in
The recruiters from the Department of Children and Families, and I'm here with the DCF Foster Care Ambassador, Deb. So we are here, we're recruiting for foster homes for our children in care. So if you have any space in your home, in your heart, for these kids, then come talk to us and learn more about how to become a foster parent.
Okay. Thank you.
So, so DCF is here. They are really advocating for foster homes. So, ladies, foster homes. So DCF, if you have space in your house and your heart, please get this to our community, because a lot of children, are in conditions that in homes that they need not to be. So if you have any space in your heart and your homes, please collect information from DCF, and so we can spread it in our community. And so now we have Save Exit.
So we're Safe Exit Initiative. I'm Deanna. I'm the program manager of Harbor, our day drop-in shelter. I also do the street outreach for our Mercedes Sprinter van.
And I'm Alex. I'm our community case manager. So we have a number to our primary mission is to end the sex trade. And so we work with predominantly survivors of commercial sexual exploitation, but also anyone who is incredibly vulnerable, right? So folks experiencing homelessness, substance use disorder, folks who, aren't accepted and welcomed in their community or lacking resources, especially like health resources is a huge vulnerability. So we have a number of different programs. We have a residential treatment program, Jana's Place, for co-occurring mental health and substance use disorder. We also have, like Deanna said, our outreach and the day drop-in. And then we do like individualized case management as well as like education in the community. So going into, different programs to bring awareness about like what does exploitation look like? How do you keep yourself safe? How do you keep other folks safe? And how do we like end demand, right? Because no person should be bought or sold.
No, exactly. Wonderful. If you don't mind, let me ask you a question. How do you guys work with like the Spectrum and the other what's the other one, Lyft, and to in this like, and then the city of Worcester also in this whole mission, because like people won't know, but people are being sexually exploited right here in our noses in Worcester. I didn't even know that. I got to know about Lyft and some of the work that they do for with vulnerable women. So I want to so what do you? How do you guys I know you guys
we were once Lyft. Now we are Safe Exit Initiative. So
that is what it is.
Yeah.
Okay.
So we rebranded, but we work very closely with other survivor-led organizations. So Ready Inspire Act is out of the Framingham area.
Okay.
They also are in Boston, I think. We also work with Amira, My Life, My Choice, Eva Center, and then we try to partner with as many organizations in Worcester as possible. Because a big piece of exploitation is the vulnerability and just surviving that kind of trauma. It's very isolating, right? So like one of the big things we try to do, in addition to folks like helping them exit, helping them access resources, is like find that community.
Yeah.
But yeah, like we partner for like folks that like need treatment. We'll work with Spectrum. We've also run groups at Spectrum. Yeah. I run groups at like a lot of like the other residential treatment programs. So I go in once a month and talk about, what does exploitation look like, and it's really just the exchange of something related to sex. So that could be like nude photos, it could be oral sex, intercourse, anything on that spectrum for something of value. And people think it's money, but like in reality,
Food, somewhere to live, clothes, just basic necessities in life that people will take advantage of.
Yeah, drugs, protection, that thing isn't always like something tangible either. It can be just a place to take a shower even, right? And so like one of the big things we do too is like trying to reduce the stigma, both, amongst survivors, because it's so hard to come forward about having gone through this, as well as the stigma in community, so that folks can, be welcomed and not judged when accessing other resources.
All right. Yeah, wonderful. Now I know that the rebranding. Thank you.
Thank you so much for coming.
Really well. Thank you. Thank you. Thank you. And
Good
then,
vibes.
We have Elder Services of Worcester.
Yes, hi. Elder Services of Worcester is a home care service that aims to keep individuals in their home. We do all ages, and then we break down departments. So depending on your age, you'll be broken down into a certain department. Our school department does cover 65 and older, and then depending on your insurance, it places you where you're at. It's honestly a good program, and the main thing is to just keep people living in their homes comfortably on their own. Some people have family members that they can live with, a lot of people don't. So there's many different services that I could run through, but the best option would be to just look up elderservices.org, and then there's a run through of all of our services and what is and isn't approved. You can also always call us at 508-756-1545 and talk to our information line, and they can get you and see exactly what you need and get you in the right place.
Thank you so much. What was the name again?
My name is Elena, and it's Elder Services of Worcester.
Oh, okay. Thank you so much. All
And
right.
I know like one of the other things that I like about Elder Service is that if you home health care, like you can. Sometimes you have contracts.
Yeah, so that is one of the services that's good. So part of keeping you in home, a lot of times people can't cook, clean, do any of those services on their own. So Elder Services will contract a vendor to come in their home and help them with the cooking, cleaning. Some of them are showering. Then they'll have PC services, which is personal care. They'll come in. They'll get paid however many times a week their insurance ends up approving. So those are the things that all tie in with keeping them in their home, because that's the biggest thing with them. Our job is to keep them in their home comfortable.
Yeah, and there's I know there's a lot of organizations, but there's a lot of awesome people, and so I know
Hi, Obaapapa. I will be coming to your stand pretty soon. So it's going on. The health training is going on. As you know, my health matters. And they stay on. Nana. Nana. Yeah. Hey, Sister Sylvia. Thank you so much.
Stuff like that. So that's my job. Am I coming to an event like this and telling you about what we're doing?
That's what I'm saying. And it just like
you will understand how
we need to make sure
how we can get resources, where to get screening.
For now.
Places that we get this. So these are things that we do about breast cancer screening, cervical cancer screening. So it's more of bringing the information to our community, connecting you to the resources, and helping you understand how everything works. So that's what we do.
Then we share.
Hi, you want to say something?
We're from the Head Start program. We're a preschool program in Worcester that are currently bringing in children born in 2020 and 2021 for this school year.
Wow. Thank you so much for coming. Yeah, so that's the outreach program for My Health Matters.
Really? That's it. Yeah, she is.
Yeah. You want to say something, Sister Lydia?
Yeah.
Go ahead. Go ahead.
Oh, okay,
It was
okay.
nice speaking with you.
Hi. So you like everybody is talking about their age.
Yes.
Okay. Hi, my name is Lydia Tonton. Yeah, I'm the CEO of Sound of Cancer Foundation for Diabetic. We are an NGO dedicated mainly to represent to service people living with diabetes and their families. Usually at times we leave the caregivers, we leave them out. But for organization we include like people living with diabetes and their families. And we are both here and in Ghana. Yeah, and every year I go to Ghana, like in November, which is Diabetes Awareness Month. I go to Ghana and we do a lot of health screenings and education, and I'm on national TV, radio, just to create awareness. And our mission is to create awareness about diabetes, to serve and represent people living with diabetes.
Yeah.
Especially, back home, there are a lot of people living with diabetes. They don't have access to health centers. They don't have access to hospitals.
And they don't even know the signs.
Yes, they lack the education. So like every year, I've been doing this since 2018. Every year I go to Ghana to do that, and it's been helping a lot. And our vision is to just reduce the prevalence of diabetes and to improve the quality of life of those living with diabetes, and to encourage them that living with diabetes is not a best
No, it's not, yeah.
so that, and give them the hope for a better and a brighter tomorrow.
That's wonderful.
Yeah.
Are you also a nurse?
Yes, I'm a nurse too, and I'm a diabetic. Yeah.
That's my I have my so even like the heredities, like you understanding like your family history.
Yes.
I have diabetes on my father's side.
Okay.
And it's like and I've seen how he's managed his diabetes. Yeah, but it's a little bit, the resources are different here than it is back home. So this is why it's so important, to bring those services not only here but also go back home. Yeah, because even here in Worcester, even here, people still don't know the signs.
They don't.
People are afraid. Yes. And then like, in the health center, like, if you don't,
in our communities,
yeah.
they're always in denial.
They're always in denial. Yeah.
They're always in denial.
And that's why it takes like nurses that are from our community, like. Like when she was talking about the pandemic, one of the most important things I felt like was getting people from our, because even then people didn't want to do PPE, they didn't want to do stuff. But the moment our nurses came to the forefront, the moment the pastors in the churches started talking about it, our the things opened up. So so this is why it's really incredible to see that you guys are nurses and you guys are not only just working, but then you're doing this and then going back home and extending help. It's incredible. So
and especially like living with my mom passed away from complications. So when I went back to I found out that my dad side, they also have their well, it's like it's in the family, so I don't joke with it.
Right, right.
Okay.
Yeah, right. Thank you. Thank you. Do you want to hear something from our?
I'm gonna do just a quick interview with her here. So
okay.
let me end this one.